Hi guys, so under hematological condition, let's talk about anemia. So patients with anemia have a reduction of total red blood cell mass, decreased concentrated concentration of red blood cells, and hemoglobin levels in the peripheral blood, and corresponding decrease in oxygen carrying capacity of the blood. So normal HB levels are in males 13.5 to 17.5 grams per deciliter. For females, it's 12.0 to 16.0 grams per deciliter. So the common cause of anemia in Kenya are hemolysis due to infections, especially malaria, and hemoglobinopathies, especially sickle cell disease. So iron deficiency due to chronic blood loss, nutritional deficiency, and intestinal parasites, such as hookworms, can be another cause. Bone marrow depression, that is a plastic anemia. So clinical features, so meticulous history is essential, such as history of previous hospitalization for sickle cell, blood loss due to menorrhagia, clinical features including irritability, listlessness, anorexia, easy fatigability, and pallor of the mucosa membrane. We also have conjunctivae, lips and tongue, nail beds and palms. This may be due to splenomegaly and a short and soft apical. Hemic systolic murmur in severe cases may present with heart failure and shock. So investigations, you do a full hemogram, HB estimation, thin blood film examination for cell morphology and blood parasites, stools for ova and heminthes occult blood. Urinalysis also is important. Bone marrow, sickling test, that is HB, electrophoresis. Management, we identify the cause and treat. If it's malaria, we give a full course of appropriate antimalarial drugs. Then after, we give antimalarial prophylaxis for 3 months. If the spleen is palpable, we continue the prophylaxis until it becomes unpalpable. So if it's iron, we give iron orally. If the anemia is mild or moderate, so for adults, we give ferrous sulfate 200 milligrams 8 hourly with folate 5 mg once daily. Continue until a minimum of 3 months after the normal HB has been reached. So we give parenteral ions in patients who cannot receive transfusion with chronic renal failure or inavailability of blood. So for those who are unable to tolerate oral iron, or if compliance is poor, we consider iron sucrose or other similar. So this also replenishes blood stores of iron levels. Also give folic acid. So I give patients who have malaria and anemia doses of 5 milligrams once daily. So for hookworm treatment, we give albendazole 400 milligrams start for adults. For sickle cell anemia, we give folic acid malarial prophylaxis, as we've mentioned earlier on. So in cases of blood transfusion, use only blood transfusion when there is a need to save life. So we not give blood transfusion routinely unless the hemoglobin levels are less than 6 grams per deciliter, or patients who have early features of hemodynamic instability, and the rate of loss of blood should be given in a decision to prove blood transfusion. So blood transfusion, we transfuse any patient with hemoglobin of less than 8 grams per deciliter, and in cases where more than 20% of blood loss, more than basically 1 liter in an adult, when there's active bleeding with shock, hypotension, cold extremities, and slow capillary refill, also do a transfusion. We also admit patients with severe anemia, with active severe bleeding, anemia of any degree of severity, to those accompanied by pneumonia, heart failure, dizziness, confusion.